I'm Dr. Manoj from Kaveri Hospital in Chennai, and I'm a senior interventional cardiologist in the adult cardiology division. My interest is mostly into coronary interventions as well as in cardiogenic shock space, as well as the newer technologies that is emerging in the field of interventional cardiology. National Interventional Council 2022, under the auspices of the Cardiology Society of India, is one of the largest pan-India meeting which is being held, attended by all the emineraries as well as national and international emineraries from the world. And we discuss the best means of treating the patients who have the heart disease, not necessarily the coronary, but non-coronary, the vascular, the valves, everything is completely and comprehensively discussed. And related to my focus of interest, I was given to talk and deliberate on the mechanical circulatory assist devices. The mechanical circulatory assist devices is a very upcoming field where we need to support the circulatory hemodynamics when a patient comes with hemodynamic collapse or a shock. Also, when you have an anticipated hemodynamic shock in a very complex high-risk cardiac patient, which could be the anatomically defined valve lesions or coronary lesions. Also, the additional medical illness the patient may have compounds the patient's ability to withstand these treatment procedures, and we have to prevent such catastrophic while performing the treatment in the cath lab. So prophylactic use upfront of the mechanical circulatory devices, as well as the use in an indicated cardiogenic shock situations, or when a patient comes with cardiac arrest, is very, very vital and should be understood in the right perspective. In this regard, we have IABP. We also have the transaxial transaortic impeller devices, which is the best device that is available. It's the smallest heart pump that is currently available in the world, which unloads the left ventricle, allows the left ventricle to recover, and also maintains systemic pressures adequately to allow the patient's heart as well as the interventional cardiologist to treat most complex of the disease process that the patient has. VA ECMO is another important entity in the mechanical circulatory devices. It comes of profound use in a patient with profound shock, as well as those who have no rhythm in the form of ventricular fibrillation or ventricular sustained refractory tachycardia, where these the IABP as well as the impeller may not be of good use. So the presentation that I gave was very comprehensive to allow everyone to understand the current scope and the role of this mechanical circulatory device assist. And I hope everybody benefits from the right way of understanding the appropriate use of these newer technologies. When we come to the coronary interventions, have a word to say about there are many, many patients who have a diffuse disease, and this diffuse disease cannot be treated always with a stent. So you have a new technology called the drug-coated balloon technology, where the sirolimus drug is coated on the surface of this balloon, and these balloons come even in the smallest of sizes of 1.5 mm. And therefore, a patient who has a multiple diffuse branch vessel disease, symptomatic with angina despite medications, we can treat and open with this drug-coated balloon technology, which will help patient to open up all these vessels, which is unable to be treated by always a stent implantation. So these are some of the scope of treatment that we can enhance the solutions for the percutaneous coronary interventions for many patients who are otherwise considered as a no-option coronary artery disease. Thank you for your attention.